Here we have the basic overview and safety check of the ceiling mounted XY gantry lift. This type of lift can move in any location underneath the track. Before we use this device, we want to visually inspect it. We want to make sure the carry bar is in good condition, make sure that there's no pieces missing, making sure that there's no tearing or fraying on the strap. We also want to make sure that the track it is on is in good condition as well. Next, we'll check the battery. The simplest way to do that is just to press the up and down button on the device, ensuring that it's functioning properly. There's usually also a battery indicator which can be found on a light on the underside of the motor. Once you are done with this device, please ensure that you place it back into charging. For some devices, this is in a specific corner, or some devices it charges wherever it is on the track. Next, we want to make sure that it's within the safe working load. We can do that by checking what the carrying capacity of the carry bar is, what the capacity of the motor is, and also what the capacity of the track is. We want to use the lowest value of these three numbers and make sure our patient is well within this. Next, we want to make sure that we have the correct sling. For our purposes, we're going to be using a universal transfer sling, but you can use a variety of slings with this device. You just want to make sure the connection point is correct. Here we have a hook and loop based system. Next, we want to make sure that our hand control is fully operable. These hand controls can vary widely depending on the type of model that you have. And you just want to ensure that it functions as needed. Up and down is all that's needed for our control. Next, we have the emergency stop. This is located on our device as a red pull cord, but sometimes this is a button. If you pull it once, it will stop the device and it will no longer function. If you then pull again and hold down, it will slowly lower the device if you have a patient in it. Make sure after you've done this that you physically reset the device so it can be used again, as it will not be operable until you hit that reset. And that is our basic safety check.